Hello, everyone, and welcome to another segment of the PF Warriors video series, Lessons Learned, sponsored by FibroGen Incorporated, a leading science-based biopharmaceutical company discovering and developing a pipeline of first-class therapeutics. My name is Shelley Mathis, Executive Director of the PF Warriors, and today I will be interviewing Dr. Naftali Kaminski, Chief of Pulmonary Critical Care and Sleep Medicine, and Berenger Ingelheim Endowed Professor of Internal Medicine at Yale University. Dr. Kaminski, welcome to this segment of Lessons Learned.
Oh, thank you for inviting me. I'm always excited to speak with you personally and also to speak to our patients.
Well, thank you for joining us. When we first had you on our educational program, it was when COVID was first starting up in the USA. Now we have multiple variants, and we're hearing that one of the latest, the XBB.1.5, is able to infect folks who have already had the vaccinations and built up immunity. Is this true? And if so, what are the research scientists working on now to offer some protection?
So I want to start actually with a little bit of a preface. And the point would be that the last 3 years have been really hard. But always there is a tendency to be worried about what's going on now without taking into consideration the perspective. It's a little bit like with IPF. We have drugs. They're not perfect, but we now have drugs. 10 years ago, we didn't have drugs. I think with COVID, it's happening faster, but it's a little bit the same. 3 years ago, let's say 2 years ago and 10 months, 2 years and 10 months ago, we were in a terrible situation. We had a virus that our immune system has never encountered. People were dying in droves. We didn't know whether our public health measures work. We did not have drugs, we did not have immunity, we did not have vaccines. Going forward now, 2 years and 10 months later, we're actually in an unprecedented situation, which is we actually have vaccines that work, we have drugs that work, but the virus is evolving. And I'll say something that will sound weird to people. The virus is evolving in a good way. So when you think about evolution and when you think about microbes, actually, microbes are not out there to kill us. They just want to survive. So it's very common that a virus or a bacteria, the first meeting that it has with a new species, it will be very lethal. But actually, when it's killing a lot of hosts, it's losing in the game. So the virus is evolving to live with us, to be less dangerous in some way. So what we're seeing now is an interesting transition in which one is we had an unbelievable success. The first generation of vaccines have given us protection from infection and from death. And what has happened is that actually viruses that learned how to, we say learn, but it happens actually randomly, but viruses that have the features that allows them, one, to evade a little bit the vaccine, and second, not to kill the host, have stayed. And that's why we have, and what happens is basically, if you look at the virus and all these names are basically just reflect the mutations, the changes in the genetic code of the virus. We now have a virus that has sort of evolved to avoid our immune protections, but it's also a less dangerous virus. So one is, it's true. XBB.1.5 can infect people who have had vaccinations. It can infect people who have been immunized and boosted, and potentially even people who have been immunized, boosted, and had the infection. But the likelihood that it will cause damage is very low. And I think this is, for me, the most reassuring thing, because some vaccines are perfect, like, or near perfect, like measles or polio. Some vaccines, like the pneumococcal vaccine that I'm sure many of our patients have taken, hopefully all of them, is not perfect, but they're good because they reduce the risk. And what's happening now is almost like the pandemic is normalized. It's not this terrible thing. The virus is normalized. It's not this serial killer. And unfortunately, the vaccine has normalized. It's now not this magic bullet, but it's still giving you a really great protection. It means also that hopefully you'll ask me, it means also we need to think about the disease slightly better. What is happening now, though, is because we now know how the virus is behaving, we know its genetic sequence, we have the tools. The mRNA vaccines are crazy easy to do. They're really cool. It's like somebody like me who's been doing RNA biology for years. It's really beautiful to see how they evolved. They're easy to modify. So I think the FDA and everybody's moving now not to approach, this is going to be the one vaccine you take in your life, but probably every year, maybe every 2 years, we don't know, you'll get a modified vaccine based on the evolution of the virus. Until hopefully the virus stops being dangerous, completely dangerous. So it will be one more vaccines, like, we get the flu vaccine. Hopefully there will be an RSV vaccine and the same thing. So we will be probably taking a booster every year, or maybe every few years, or maybe a combination of things. But it's sort of, there was a small period of time, and some of you follow me on social media, I think have heard me screaming it, between January 2020 and April 2020, there was a small period of time that we could have shut down this pandemic. But once we haven't done it, that's it. The virus is everywhere. Some people will never get infected, but most of us do get infected. We had a holiday party, our first holiday party in 3 years in the section. We did it safely, and I got infected because I was giving out candy to the kids, and but it wasn't that terrible, and I got Paxlovid, and it just went through, but it's very different than 3 years ago.
This is very encouraging news indeed. Thank you for giving us a lift today. But some of the PF patients were immunocompromised, so the vaccinations did not work on them, and they got monoclonal antibody infusions. Are those things still working?
That's a problem, actually. The EvoShield, the monoclonal antibody that is protected, I don't think it's giving any protection anymore. I'm sure there will be a modified version. These things take a little bit longer to test, and sometimes because with the monoclonal antibody, you need to assess the safety more carefully, but I'm sure that there's going to be a second and third generation of these antibodies, but they're not there yet. So we've lost an important tool in the protection against COVID.
Well, most of us at home now have COVID test kits. So if a PF patient finds that he or she is positive, what should they do? Is Paxlovid still an effective treatment for the new variants? There was an article today in the New York Times about a lot of physicians beginning to move away from Paxlovid.
I don't know why anybody would move away from Paxlovid. It's highly effective. And the recent studies have shown both definitely a reduction in dramatic reduction in mortality and hospitalization, and also reduction in symptoms. And I think for our patients, the last thing you need is an increase in your cough, right? The last thing that you need is an increase in feeling even worse than you feel. So we think that people at least definitely should take Paxlovid. It keeps working. It's very important to exactly have your home test. I do recommend, I don't want to limit people socially, but at periods that the virus is going up, like as it was in December, it may be a good idea to ask people who come visit in your home to actually get tested before. It's not a big deal. You know, it takes 15 minutes. Having a HEPA filter, really good at home. Actually, some of these machines now that you can get, you know, on Amazon, they cost you $120, and they refresh your air dramatically. They may also be good for other things, for air pollution, other things. The science is not there yet. Or let's say the evidence is not there yet that it helps. But I think now that the prices have gone down because of the demand, having an air purifier at home is not a bad idea. And some of these things, if you look at, again, I'm not an expert on the engineering of these machines, but if you look at their specifications, they can easily refresh the air of, of even a big space, 100 square feet, within relatively quickly, multiple times. So it's almost like you're keeping your window open without having it open. So I think that thinking about your security and not being shy about it is important. Of course, not hesitating to wear good masks and 95s, definitely. But having said that, if you don't feel well, and our advice to IPF patients always has been that if you get a viral infection, that's not something you always consult your physician, do a rapid test. If it's positive, get a prescription for Paxlovid. Majority of people, this will affect both the symptoms and their definitely protect them. There are some side effects that are mild. Most of the problem is with drug-drug interactions. But even there, people have been making it bigger than it is. So for most drugs that we take, stopping for a week or 8 days, nothing happens, right? You just need your doctor to tell you, or the pharmacist to tell you to do it. So, like I'm on a statin, right? So when I started taking Paxlovid, my doctor okay, don't take your statin for 8 days. That's it, right? So it makes sense, not a big deal. I did have a little bit of a metal taste in my mouth, the way people tell you, like, so I like good Italian coffee, and it tasted more like Starbucks in the morning, but I can survive it. So I highly recommend not to be very rational about this thing. And I think many of our patients, they are in some ways, I don't know how you call them, they go on. They're survivors, even though there's no cure for the disease. So I think the same rational approach that allows you to live with the disease is the same rational approach you apply to this. Don't get scared by the internet. Don't get scared by some contrarian people. Follow the guidelines.
Thank you for that information. That's very valuable. And we can be scared by the internet and articles in the newspapers. So now I want to ask you about COVID that turns bad and you get long COVID. And I understand that there is an interdisciplinary clinic at Yale and maybe a few other places that have physicians from the other disciplines like neurology, rheumatology, cardiology, psychiatry, pulmonary rehab, maybe others. Do you have any insight into how this is working to treat long COVID patients? Because that condition can be devastating and deadly.
Yeah, so I want to distinguish actually between several types of long COVID, and I'll say it carefully because the science is evolving. This is a new disease. So we do know that some people who've had COVID present this long-term syndrome, combination of symptoms, including shortness of breath and, the brain fog and limitations in exercise and chronic pain and other things. And we have found some biological correlates for these. And the most stressful thing is that for a lot of these people, you cannot find like one thing that goes wrong, right? So I always I learned this from my mother. I always focus on the positive. So I told the patient, oh, okay, it's good that we didn't find one thing bad, right? But the truth is, it's also very distressing because people have no answer to what's bothering them, and they're still limited. There's no proven therapies now. We do know that rehabilitation is good. We do know that doing the evaluation and ruling out blood clots and problems in the heart and the lung is really helpful. We also know that therapy actually helps to prevent long COVID. So we mentioned Paxlovid. Paxlovid treatment also reduces the incidence of long COVID. There's another thing that's relatively common after COVID infection that is not getting that much attention, which is, I don't know if you call it short-term long COVID or something. Just people after they've had, especially with the newer viruses, they have symptoms for 4 to 6 weeks. It goes away afterwards, but they cough, they're short of breath. Again, another concern, especially with our patient population. Some people have almost like a post-viral bronchitis. This is slightly easier to treat. If people see a pulmonologist, they get an inhaler, they get a little bit, maybe some inflammatory, something else, and they get better. But long COVID is for us still a medical mystery, and we don't have proven therapies. What we've learned in our clinic is that I think some people just get better. It's more like a recognition, adaptation in the workplace, exercise. They just get better, even if we don't know exactly what to do. But it is a debilitating syndrome.
It is indeed, and it seems like it would be hard on the PF patient in particular if they got a case of long COVID. It's hard enough for them to breathe easy and without that interruption.
Yeah, I think the focus on IPF is, and I actually think the community has been, because it's, again, I love this community because people are responsible and thoughtful and also stick together, right? So I think our community has been relatively good at protecting themselves. And I think that's what I would encourage people. But by the way, I remember 20 years ago, I remember when I was sort of more of a real busy physician, I remember telling IPF patients, if your grandchild has a little bit of cough, try to stay away. I know it's hard, right? So the viruses were a threat to IPF patients before COVID. And I think paying attention to the numbers, I know it's a little bit stressful. If the numbers in your case are going up, put your mask, put the extra precautions, and then just seek medical advice. I don't think we have seen, at least not in the recent waves, a sort of an out of proportion effect in the IPF population. I think part of it because our patients were careful.
We are indeed very careful, and we know that it's important still to be part of the community, and we think that these Zoom phone calls, and we love our professional providers like you because they have been so generous with their time and information. during this COVID period. So that just about ends our questions for you, although my husband wanted to ask you for a good recipe for falafel, because we see you enjoying your family and the best looking food in the world. So maybe you'll share that with us later.
Yeah, I'll do it later. I just think about
So,
masks to our patient population. I don't know, it's like some people feel that they have to attack masks. Has nothing to do with science. But here's the thing, it's very easy to get N95s now. They're not that expensive. You can get them on Amazon, or rather get a stash of them.
Mhm.
And whenever you're worried, just put it on. It's very simple. And sometimes I'm seeing now a little bit, luckily not in Connecticut, but in other states, I've seen that actually medical professionals are not using masks. So if you're going to a physician, you have a pulmonary condition, it's your right to ask to be protected, right? So don't hesitate. And because this is not about theoretical risk, this is real. So especially when cases are coming up, put your N95. If it's a person coming into the home, again, think about having a air purifier or something like this, and potentially just ask them to put the mask on, especially when things are, hopefully now we go into spring and cases go down and it's much safer.
Let's hope for it. Yes, for spring needs to get here soon. It's even snowing in Dallas today. Holy smokes.
Wow. Oh, wow.
So thank you, Dr. Kaminski, for joining us today for a very important segment of Lessons Learned. And thank you, FibroGen, for making these video shorts possible. And thank all of you for watching this segment today of the PF Warriors video series, Lessons Learned. Goodbye for now.